Is the state government putting at risk millions of dollars in Commonwealth funding as a result of its decision to slash elective surgery? Some federal Labor members have condemned the Tasmanian Labor government's cuts and claim it breaches a deal with the Commonwealth. I spoke to State Health Minister Michelle O'Byrne in Launceston this afternoon. Michelle O'Byrne, welcome. You've cut $60 million from elective surgery to save money, but aren't you in turn jeopardising more than double that in funding from the Commonwealth by reducing the number of operations?
Well, I'd be really disappointed in any Australian government that decided that the way to assist Tasmanians through the challenging budget that we have would be to, in fact, punish us any further. There is an issue about whether we reach our reward payments, but I think this is an opportunity for the Australian government to work with us because they know, as Tasmanians know, that we have lost $1.7 billion in revenue over the forward estimates. They know GST revenue has fallen. It can come as no surprise to them that governments across Australia are having to manage health budgets through challenging times.
But Tasmania's consistently underperformed in comparison with other states. Why?
We have, in a recent assessment of meeting targets, actually come in second of all states in meeting a number of targets. 6 out of 7 of our targets. The elective surgery waiting list was one of our challenges. We do have an ageing population. We have a highly dispersed population that does put pressure on our health budgets. Now, at the moment, we have our budget challenge to meet. We also have national health reform, and that is forcing us to do something which we probably should have done over many years, and that's looking at the cost behind the services, because from 1 July next year, we will be paid per activity a nationally set price, and we have to be at least close to that nationally efficient based price, otherwise we won't be able to get the support that we need to meet Tasmania's health challenge into the future.
Why did Tasmania sign on to the national reform package if you're now saying, oh well, actually maybe the federal government should take it over?
Well, we've always said that we believe that the end point of national health reform is not necessarily a federal takeover or a fully state responsible service, but it is about having a single funding stream of health where inefficiencies occur, where cost shifting can happen, because we have different levels of government, different services providing similar or same services. I think, and I've had informal conversations with the Commonwealth to say that Tasmania is incredibly well placed to trial where health in Australia should eventually get to, which is a single funding stream of health to ensure a seamless transition for patients, but also to ensure that we don't have the duplication in either administration or processes that we do have now.
Julie Collins and the National Health Minister, the Federal Health Minister Nicola Roxon, have said that there is a chance, and it's being examined, whether in fact the state is in breach of that agreement. Are you going to make any special pleas or requests to the Federal Health Minister in relation to this latest announcement of cuts and possible placing in jeopardy of $140-odd million in return?
Well, the National Partnership Agreement makes it very clear that I, as an individual health minister, could not take funds out of health merely because the Australian government were putting funds in. And it is very clear to make sure that that sort of shift of money doesn't occur within state governments. What is happening in Tasmania is that our entire budget and every department is being asked to find savings, and that is different to a minister making a decision to funnel money somewhere else. This is about recognising that we don't have the money to deliver the things that we currently do. It's about making sure that we can come in a sustainable position too. Now, I do want to work with the Federal Health Minister because I do believe that at the end point we're all here because we do think we need to provide a sustainable health system into the future. We signed onto the NPA because we believe the Commonwealth should be a proper partner in funding of health. The reason that we are in this challenge is not because we're walking away from the NPA, it's not because we've made a decision to spend money elsewhere, it's because the Commonwealth have delivered through GST revenue to the state a substantial reduction. We have lost $1.7 billion. There is no more money.
Isn't that exactly what's happening, though, even today? We have announcements of reduced funding in mental health, yet earlier in the week we had announcement of the federal government increasing funding to mental health. The state seems to be taking while the federal government is giving.
Well, that's a misunderstanding of how the funding might actually play, and it comes back to my exact point about single funding streams. That's not necessarily delivered when you have fragmentation of services. So a lot of the change that we're doing through mental health is looking at the way the Australian government is funding and trying to remove that fragmentation.
Nicola Roxon says state government savings should be in administration, not frontline services, and that she's disappointed that what she's seeing is in fact the loss of frontline services.
Ellie, this is a really tough decision. This is not a decision that I relish. That you don't go into health deciding that you are going to make any decision that impacts on elective surgery waiting lists. But we have gone through every other area across the Department of Health and Human Services where we can find savings.
The AMA says that you claim that $70 million of savings in health are in fact as a consequence of making efficiencies of the non-frontline kind. How long then has the state health sector been inefficient? John Davis has said over 10 years. That amounts to $700 million.
Well, I think one of the things is that in Australia and in Tasmania as well, when we have an issue in health, we've had an immediate response that the way to respond to it is to spend more money to fix that problem. I think we need to change the way that we're approaching healthcare so that we do probably more like New Zealand does, and that says, have we spent every single dollar in health wisely?
With respect,
hindsight is a marvellous thing, but hindsight's a marvellous thing, Ellie. What I'm saying is that I've responsibility for the budget now. I've been given a target now, and I'm using every opportunity that I have within that target to make sure that we are as efficient and remove any cost behind the delivery service that we can. It's not an easy process, but it's one that I'm committed to.
Just briefly on that, with the three new the Tasmanian health organisations, it means that's going to mean another level of management, estimated to cost around about $1 million a year. Are there, as a consequence, going to be bureaucratic jobs to go, given there's going to be more people involved in the management?
Absolutely. I've made it very clear for the last 12 months that the Department of Health, as people recognise the bureaucracy, will turn more into a Ministry of Health. Our job will be still in the public health space. It'll be in the legislative and quality assurance and federal relations space. But then our job will be commissioning, and we will be purchasing services from our area health services. And that means the department needs to shrink substantially, because a lot of the work that we have done won't be needed to be done by us.
Michelle O'Byrne, we're out of time. Thank you.
Thank you.